Pharmacists use their knowledge to dispense drugs and to advise the public on their proper use. Among the many medical professions, pharmacy has one of the widest varieties of work situations, from hospitals to drugstores. We spent some time with a pharmacist to learn more about this interesting and varied occupation.
My name is Lori Ray. I'm the pharmacist owner of the medicine shop here in Beverly. I've been the pharmacist here for 16 years. Thinking about careers in high school, I remember looking at options. I was interested in science, went to talk to the local town pharmacist and thought it looked interesting and decided to go ahead and pursue it. And once I got in, I never thought I wanted to do anything else. Good morning. I was accepted into the faculty of pharmacy straight from high school, so was one of the youngest kids. Back then you could come out of high school, now you no longer can. I took the 5-year program then, so 5 years of university. Difficult, definitely. Heavy in the sciences, heavy in the labs. Great faculty though, small faculty, get to know your teachers and the fellow students, and that was the experience of university. How are you?
Hi.
After I graduated, I worked for a chain for about a year and a half. And at that point, I realized I wanted more of a patient-centered focus or more of a clinical focus, which is how I arrived here. And I ended up being an owner. So did I know a lot about business? No. Learned it along the way. It's certainly a challenge, but it's a whole different aspect. It's the business of pharmacy plus being a pharmacist. And just being a business owner, everything from payroll to paying invoices and all that sort of thing. But just adds another fun dynamic, I guess. A typical day here would start with me coming in and just getting the pharmacy all ready to go for business, which would be getting the till ready, getting the computers ready, having a look at what happened from the day before and making sure loose ends are tied up. Once the day begins, we deal a lot with the patients as they come in. We never know what that will bring. So they're bringing us new prescriptions or needing refilled prescriptions for things we already have on file. Different working hours as a pharmacist. I think the whole spectrum exists. Here we work days and a half day on weekends, no holidays. Some of the chains would be evenings, weekends, holidays. Hospitals could be shift work. So I think you can run the full gamut. It could be as flexible as you need it to be. One of the important things that pharmacists do is identify potential drug-related problems or drug interactions. So knowing the medications well and how they interact with others is a very important part of what we do.
So your pulse is identical, but that top one starts...
I think some people may be surprised to know that we're taking blood pressures and reporting those values onto their physicians. I think they may be surprised that we're doing vaccinations now. Some people are surprised that we do blister packaging. We do home visits for patients who perhaps can't get out, or if we identify problems that we think might need to be evaluated, and sometimes that's best to do in a home situation. The nice part about a home visit is it allows us to sit in their home and in a comfortable environment with the patient, and often we're able to get a lot more information from a patient in that scenario. Sometimes we're the first stop in the medical health system. So people will come in because they've established a relationship with us over the years, and whether it be they have a cold and they want something over the counter, or they're having trouble breathing, they think it's due to a cold, but because we have some of the other information on their health profile, we may be able to identify things that alert us to the fact that, you know, this is not where we need to be taking care of them. We need to refer them on to their physician. So bridging the gap, but sometimes just referring them straight on, in that, you know, this isn't where you need to be. You really need to get in to either see your doctor or another healthcare professional. The work-life balance as a pharmacist has worked well for me. I get to do a great deal of spending time with my kids and chauffeuring them around, volunteering at the school. It's just been a great balance. You can do a lot within the profession depending on where you want to be or what you want to focus on. You know, if you want to do private practice, or if you'd like to work in collaboration with other healthcare professionals or work in a hospital setting, I think that, especially with our expanded scopes of practice that we've been granted, it just opens a lot of doors, and so the whole gamut is in front of pharmacists right now. Being a pharmacist, I find to be very satisfying because it changes every day. The patients you deal with change every day. The problems you deal with change every day. The physicians you deal with change every day. So it's never the same thing. At times it's extremely hectic. You have discharges from the hospital and some problem with a patient that you've had for years who's on home care. It's just constantly changing. It changes also within the, new medications coming out, new therapies, new patients that you're gaining, new relationships that you're forming with your patients. So it's just constantly evolving. Pharmacy's been a wonderful career choice. I still love getting up to go to work, and I love what I do. I enjoy the challenges of day-to-day practice, and 16 years later, I'm still smiling.
To become a pharmacist, you will typically require 5 or more years of post-secondary studies. If working as a pharmacist interests you, there's more information available, including salary ranges and educational requirements in the occupational profiles on ALICE. You may also be interested in the related occupations of pharmacologist or chemist. Learn more on the ALICE website and make the most of your future. Visit us at alice.alberta.ca.